So today we will together study a very important topic, valvular heart diseases. So let's discuss the anatomy of the heart first initially, and the anatomy along with the physiology. How is the blood being pumped? Let's recap. And as you all know that the heart is divided into four chambers, and the right atrium, right ventricle, left atrium, left ventricle. So basically, the deoxygenated blood that is coming from all over the body is coming through superior vena cava, and the inferior vena cava, and then it enters the right atrium. It will enter the right atrium, and through the tricuspid valve, it will go to the right ventricle. And there are a few structures which is responsible for the electrical activity in heart. That is SA node, AV node. I'll just clear the basics and only the important stuff, and rest you can review it later. So from the right atrium, like I said, the deoxygenated blood enters through inferior vena cava and superior vena cava towards the right atrium, and then the right atrium, the deoxygenated blood from the right atrium will go to the right ventricle through tricuspid valve. So this tricuspid valve TV is present in between the right atrium and right ventricle. Then the deoxygenated blood from the right ventricle enters the pulmonary artery. Then it enters the pulmonary artery. Okay, from the right ventricle it goes to the pulmonary artery through. There's a valve present here. I'll show you the valve present called the pulmonic valve. Okay, the pulmonic valve is present here. Okay, the pulmonic valve which will open, and then it goes to the pulmonary artery, and then goes to the lungs for oxygenation. Okay, for oxygenation. And then after getting oxygenated, the oxygenated blood from lungs, the oxygenated blood will go to pulmonary veins, and then to the left atrium, and from left atrium it goes to the left ventricle through the mitral valve. So the mitral valve is present in between the left atrium and left ventricle. Okay, from left ventricle the oxygenated blood will go to the aorta. There's a valve present here, aortic valve. Through the aortic valve to aorta, and the oxygen, then it's pumped to all the parts, in different parts of the body. Okay, see, the oxygenated blood is pumped towards the different parts from the left ventricle. Okay, so this is the basic physiology in the anatomy of the heart. And as you all know, if there's any problem with these valves, we discussed four valves, right? Tricuspid, mitral valve, and the aortic valve, or the pulmonic valve. If there's any problem in these valves, the whole circulation will get disrupted. Okay, the whole circulation will get disrupted. So as you all know, there's only two. Basically, the arteries carry the oxygenated blood, and the veins carry the deoxygenated blood, right? But there's only two parts in our body where it is opposite: the artery carrying the deoxygenated and the veins carrying the oxygenated. And that one is the heart, like we discussed, the heart, and the second is the umbilical artery that carries the oxygenated blood from the fetus to the placenta. Okay, so this is only two areas where it's the artery carrying the deoxygenated blood, okay, and the veins carrying the oxygenated blood. There's only two places where this is happening. Okay, so let's discuss about the topic today, the valvular heart disease. Let me tell you about the heart sounds. So the S1 and S2, and when we auscultate, we hear lub, dub, S1, dub, S2. So the lub is produced when the two valves we discussed earlier, tricuspid, which is present between the right atrium and right ventricle, and the mitral valve, which is present between the left atrium and left ventricle, when they close, we hear the lub sound. Okay, and that is the beginning of the systolic phase. And the same as the S2 sound, when the aortic and pulmonic valve closes, we hear the dub sound, and that is the beginning of the diastolic phase. Okay, that is the beginning of the diastolic phase, as we discussed earlier. When the mitral and tricuspid closes, we hear the S1, and when the aortic and pulmonary valve closes, we hear the S2. So when the mitral and tricuspid closes, that is the beginning of the systolic phase, and when the aortic and pulmonary valve closes, that is the beginning. When you hear the S2, that is the beginning of the diastolic phase. Abnormal sounds, mainly what's heard is murmurs. So if there's any problem with the valve, like we discussed, the mitral valve or the tricuspid valve, basically the abnormality of the valves and the murmurs happen due to two conditions. One is stenosis, second is regurgitation. Okay, regurgitation. Okay, so what's stenosis and what is regurgitation? What's the difference? Stenosis is when the valve constricts. There's no enough space for the blood to go through. Okay, there's no enough space for the blood to go through. And regurgitation is when there's backflow of the blood. It's a backflow of the blood. Okay, so like we discussed earlier, when at the end of the systole, your mitral and tricuspid has to close. So what happens? And at the end of the diastole, your aortic and pulmonic closes. So if it doesn't close properly due to stenosis, what happens? It will produce turbulence or murmur. It will produce murmurs, or due to the turbulence. Okay, due to the turbulence. So what happens in let's discuss one by one. In mitral stenosis, what happens? What happens? In the mitral stenosis, we'll go in detail, guys. So in mitral stenosis, the blood must force its way through it. Okay, so due to less space, it cannot go through. So you know that mitral is present in the left, in between the left atrium and left ventricle. So there will be problem in the blood going from left atrium to the left ventricle. Okay, so the mitral, due to mitral stenosis, so what will it cause? It will cause what happened? A murmur. Okay, it will cause a murmur. Same concept for the tricuspid. Okay, tricuspid stenosis. It's between tricuspid stenosis. It's between the right atrium to right ventricle. So if there is tricuspid stenosis, a problem in going, and this will also cause a murmur. And what type of murmur? What do you hear? I'll explain later. So I'll do it fast. The next is what happens in stenosis. Is the same concept. There's also aortic stenosis, you know, and there's also pulmonic stenosis. We are discussing about the stenosis initially. Okay, where is the blood? Where's the problem here? After left ventricle to the aorta. Okay, left ventricle to the aorta. Problem in the aortic valve. Okay, aortic valve. Problem in the aortic valve. And here, where is the blood going from? Here, from the right ventricle to pulmonary. What is it, guys? Pulmonary vein or artery. It's the deoxygenated blood. So I mentioned earlier, only two conditions to the pulmonary artery. So which valve is affected here? There is a stenosis of pulmonic valve. Okay, problem in the pulmonic valve. So this is the basic. And now let's the same for regurgitation. Okay, what happens in regurgitation? There is the same like mitral regurgitation, tricuspid regurgitation, aortic regurgitation, pulmonic regurgitation. Okay, so in all of these conditions, what happens? There is a backflow of the blood due to pressure differences that I'll explain later in a while. Okay, so what happens is when there is backflow, the blood that is supposed to be ejected, right? The blood that is supposed to be ejected by the ventricles, they will also produce murmur. The blood that was supposed to be ejected by the ventricles, they will be clashed. There will be clash of the titans. Okay, clash of the blood that is already present in the ventricle. So there is basically backflow. So okay, there is basically backflow of the blood. Okay, so now let's go in detail. We'll discuss one by one. What happens in aortic regurgitation? What happens in aortic regurgitation? There are three murmurs that's heard. Okay, there are three murmurs. What are the three murmurs? There is systolic murmur, there is diastolic murmur, and both of them are heard over the left. Both of them are heard over the left sternal border of the heart. Okay, left sternal border of the heart. And there's also systolic murmur heard over the apex. Okay, so guys, I will show you the oscillatory of points where we can hear the murmurs. Guys, we were discussing about aortic regurgitation. So there are three murmurs that's heard, and we can hear them where we can hear the aortic regurgitation. That is basically blood flows back from aorta to the ventricle. The blood flows back from aorta to left. I told you regurgitation is backflow ventricle. Okay, so what happens? What we can hear, where the site of hearing, where we can hear the regurgitation, the aortic regurgitation in the left side. Okay, in the second and the fourth intercostal space, the left sternal edge, we can hear them. Okay, in the second to fourth intercostal space, the left sternal angle. Okay, so what is the character of the sound? Okay, what do we hear? It's blowing decrescendo pattern. Okay, blowing decrescendo pattern. Also, there's a feature called Austin Flint murmur. Okay, Austin Flint murmur. What is this? Austin Flint murmur is basically rumbling. It's basically a rumbling sound. Mid diastolic jet murmur. Mid diastolic jet murmur. Okay, can be also heard in aortic regurgitation. Okay, so this is about aortic regurgitation. Now let's discuss about aortic stenosis. Told you, constriction. Okay, what happens? in aortic stenosis. Where is it heard? Aortic stenosis is heard in the aortic area, right? Aortic stenosis is heard in the aortic area. Okay. How is the character? Aortic area. What is the character? Character is, important point guys, it's a crescendo. It is a character of the sound, okay? It is a crescendo, decrescendo pattern, okay? So basically, crescendo means increase and then decrease, okay? The sound wave will be decreasing, increasing initially, then decreasing. Okay, you can hear them in YouTube. Okay. Increasing, decreasing, okay? This is how it is. Increasing, then decreasing. In the sound wave pattern, you can hear. Okay, in between in the systolic phase, okay? In the systolic phase. So what happens is, in the systolic phase, guys, which phase in regurgitation, it's a backflow, right? So in which phase this comes? Aortic regurgitation is in the early diastolic phase, okay? Early diastolic phase, and this is in the systolic phase, okay? Stenosis. Now there are some extra features, like in stenosis there will be narrow pulse pressure, like the difference between the systolic blood pressure and diastolic blood pressure, it will be narrow in the case of aortic stenosis. Okay, this is about aortic stenosis. Now let's discuss about mitral stenosis. In mitral stenosis, it's basically narrowing of what? Narrowing of mitral valve. Okay, narrowing of mitral valve. Sorry, I will come back to that later. There's some features I would like to discuss in aortic stenosis. In aortic stenosis, there is basically what are the symptoms? How do the patients come? I told you about decrescendo pattern, right? Murmur. And what are the symptoms in patients? Symptoms in patients, like patients come with syncope, come with angina, exertional dyspnea. Okay, there will be exertional dyspnea. Symptoms like syncope, angina, and exertional dyspnea. Okay, remember it as sad mnemonic. Okay, in what? In aortic stenosis. We're discussing aortic stenosis. Okay, so what do we do in aortic stenosis? We have to keep it open, right? What we have to do is, what is the next step in aortic stenosis, guys? It's TTE, transthoracic echocardiogram. Okay, so by doing this echo, we will understand the gradient. Okay, so it's divided into mild, moderate, and severe. So depending on the gradient, we'll know what treatment to do. So treatment, basically, there is percutaneous valve, it's stenosis, right? Valve dilatation. Okay, using a balloon. Okay, a procedure that uses a catheter and balloon to treat the heart valve stenosis. Also, there is SAVR and TAVI. SAVR is surgical, it's aortic valve replacement. Okay, surgical aortic valve replacement, and TAVI is transcatheter aortic valve implantation. So nowadays this is preferred, guys. This is more preferred. Again, after the echo. Okay, so next we'll discuss about we did aortic regurgitation, aortic stenosis. Now we'll discuss about mitral valve stenosis. Okay, what happens in mitral valve stenosis? The mitral valve is stenosed. Okay, in this, where is the site heard? Apex. You can hear it in the apex. You hear a rumbling sound. Okay, the character is rumbling sound. Also, so what is mitral valve? There is a resistance. Okay, it's a narrowing of a mitral valve, so there is a resistance from LA to LV. There is a resistance. Okay, because of the mitral valve stenosis. Okay, and what are the features? You see patients coming with malar flash. Malar flush, which is the facial flushing due to chronic hypoxia. Okay, then next is MR, mitral regurgitation, which is backflow again. And what happens here is there's a backflow of blood from, was it LV to LA? Okay, LV to LA, the blood leaks. Okay, so again the site is where you can hear it in apex. Okay, the apex. You know the apex, right? You know, right? In the fifth intercostal space, mid clavicular line. Okay. Okay. Now, what happens in mitral regurgitation? Before that, in mitral stenosis, I wanted to discuss more. What do we hear in mitral stenosis? There are a few things. So, guys, in mitral stenosis, there is increased risk of AFib, increased risk of atrial fibrillation. Okay, this is hallmark finding. there is a hallmark finding is loud S1. It's loud S1 sound. Okay, loud S1. So what happens when there is mitral stenosis? The blood is not able to flow through the mitral valve. Okay, so blood, what happens is when the blood cannot flow from left atrium to left ventricle, what happens? There will be, the blood will back up in lungs. The blood backs up in lungs, which will cause pulmonary hypertension. Okay, so what will happen? The right ventricle has to push harder because of the backflow. Okay, so you'll also hear loud P2 as well. So hallmark finding is loud S1. Okay, loud S1. Now we can discuss about mitral regurgitation. Okay, that is basically backflow, mitral regurgitation, the backflow of blood from left ventricle to left atrium. Okay, because of the insufficient mitral valve. Okay, again the site is in the apex, you can hear, and character is there is a blowing sound. Okay, blowing sound, and mainly it's heard in the apex. Okay, so there's some extra features like squatting will what increase the afterload. Okay, in this, so more blood will pass from LV to LA. Now next is pulmonary stenosis, mitral stenosis, then in pulmonary stenosis, again the pulmonic valve is stenosed. What happens here? So there is a resistance of blood from right ventricle to pulmonary artery vein. Okay, so there is a resistance, increase resistance. So this features pulmonary stenosis. Remember guys, it's seen mainly in TOF, tetralogy. It's one of the features of tetralogy, a feature of tetralogy of Fallot. Okay, seen in child. Okay, then where do you hear the situs? Pulmonic area. Okay, situs pulmonic area. Sorry, situs the pulmonic area. Here also you can see crescendo, decrescendo nature. Okay, crescendo, decrescendo pattern, the murmur. Okay, now what are the extra features? You will hear fixed S2 splitting sound. Okay, what's pulmonary regurgitation? Next one. What happens here? Here is blood leaks from backflow, right? Blood from right ventricle to right atrium. Okay, right ventricle, because it cannot be pumped. So what happens is it will come back to right ventricle to right atrium. Okay, it's usually due to pulmonary hypertension. And what's the murmur guys here? Murmur is Graham-Steele murmur, called as Graham-Steele murmur. Okay, now next is some patient, there is mitral valve prolapse guys. This is also a condition, mitral valve prolapse. Have you heard about mitral valve prolapse? In mitral valve prolapse, it's only seen in 10% of the population. It's more common in women. There is a increased risk of systemic thromboembolism. Okay, mitral valve prolapse. Okay, okay, so this is it guys. So how do we remember all this? I'll give you a mnemonic, easy to remember. I'll tell you a mnemonic. T-PAM. Okay, T-PAM. The case of systolic murmurs, we have diastolic and systolic murmurs, right? We have both murmurs. Systolic murmurs, it is systolic murmurs, you can say RSSR. Okay, in systolic murmurs are the tricuspid regurgitation, pulmonic stenosis, aortic stenosis, mitral regurgitation. Okay, basically in systolic, what closes? Systolic, both of them, tricuspid and mitral, S1, right? in systolic, and the pulmonic and aorta opens. So when does the systolic murmur happen? When there is a stenosis of pulmonary and aortic stenosis, and when there is backflow of, when there is a problem tricuspid regurgitation and mitral regurgitation. Okay, so just to remember TPAM and RSSR. And in the case of diastolic murmur, case of diastolic murmurs, remember it as, you shift SRRS, that is tricuspid stenosis, pulmonary regurgitation, aortic regurgitation, and mitral stenosis. Okay, just to remember for easy. So just remember one thing. TPAM, RSSR, and then when it comes in systolic murmurs, and when it comes to diastolic, shift the SS and put RS in between. Diastolic murmurs. So easy to remember. And you can, this is it. Thank you.